Welcome to everyone at Penn Medicine Princeton House Behavioral Health. We're so pleased you could join us for the official kickoff to our 50th anniversary year by attending this employee town hall meeting. Whether you are watching at the Princeton House inpatient campus on Harrington Road, at one of our outpatient sites, or from your home office, each and every one of you has contributed to making Princeton House Behavioral Health the success that it is, and for building our reputation for clinical excellence and compassion. We thank you.
We chose the tagline, celebrating 50 years of providing hope, innovating care, and changing lives, and we think that perfectly describes us.
This past year has stretched us in so many ways, and in true Princeton House form, we ended up creating new treatment protocols, using technology to engage and conduct treatment, and measuring our outcomes, which were shown to be excellent. We learned how to conduct therapeutic groups with masks and social distancing, to safely provide aerosolizing procedures such as ECT while following CDC guidelines, and to engage children and adults for 3 hours per day via telehealth.
We hear from patients every day about the difference you make in their lives, and we also know that for every grateful comment, hours and days and weeks of your effort contributed to helping that individual and their family move toward recovery.
Today we celebrate our history and the people who made Princeton House Behavioral Health what it is today.
Throughout the year, you'll see articles, signage, social media posts, and events that will highlight the work we do at Princeton House. This is an opportunity to advocate for our patients and educate about the value of mental health and substance use treatment, and we're going to make the most of it.
At Penn Medicine Princeton Medical Center, we will be hosting a table monthly throughout the year to engage patients, visitors, and staff in conversations about mental wellness.
You'll notice a mental wellness section in Princeton Health magazine starting in September. Collecting the lectures, activities, and events in one location shows that our system values mental health for our patients and community.
And you can tell the story of our anniversary to anyone you meet when you use a gift of your choice that features our 50th anniversary logo.
Every employee will be receiving a link to a site that has an array of items. You'll choose your favorite, and it will be shipped to your home or office. It's a small token of appreciation for all the important work that you do.
We will soon announce some celebrations just for the Princeton House family. The first is October 16th, where we will have an opportunity to gather for an outdoor movie at Princeton Medical Center in Plainsboro. Like a drive-in movie, you can bring your family and friends or gather with your work family to watch the film.
Today, we will hear from a few more folks on the occasion of our anniversary, and later we'll view a brand new video about our history.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you again for all that you do.
Thank you again for all that you do. I'll now hand you over to Kevin Mahoney, CEO of Penn Medicine.
Hello, my Princeton House colleagues. Congratulations on 50 years. This safe haven has grown tremendously over the last 5 decades and has increased access to behavioral health resources for thousands of New Jersey patients each year, right here in their own community. This is an incredible story of commitment, compassion, and innovation. You are the true north on our patients' journey to recovery, and I know this from my own family's experience, and I could not be more proud of the work you lead. Thank you for all you do each and every day. The next 50 years will be different, be more virtual, more digital, but I know at the core, the compassion that you provide to our patients is what's going to lead us, and I can't wait to see what the next 50 years hold. I will now turn the program over to James Dimitriadis, Chief Executive Officer of Penn Medicine Princeton Health.
Thank you very much, Kevin. 50 years ago, our board showed the foresight to champion behavioral health care, and ever since, our people have demonstrated an unwavering commitment to helping people change their lives for the better. Today, Princeton House Behavioral Health is recognized as a true leader in the field. We've heard before that medicine is a mix of art and science, and that is especially true in behavioral health. We're proud that Princeton House offers evidence-based treatment and that staff members work together to find new ways to help our patients. Whether it's instilling the concept of hope, into patients struggling with mental health, eating disorders, or substance abuse, finding new ways to engage patients using telehealth, or creating safe spaces for first responders to address trauma. It's the people who work at Princeton House using their creativity, their expertise, and their kindness to benefit our community. Thank you to the physicians and staff at Princeton House on 50 years of providing hope, innovating care, and changing lives. Princeton House is a crucial part of Penn Medicine Princeton Health and a vital resource to the communities we serve. Now let's hear from some of our friends from around the community.
Hi, Mark Frieda, Mayor of Princeton here. I just wanted to add my thanks to Princeton House and everyone involved in Princeton House for 50 years of great service to the community and to the greater central New Jersey area. We recently passed a proclamation. I'm not going to read the whole thing, but I think it's important to note that Princeton House was founded in July of 1971. It has grown to be a 116-bed hospital that treats adults with psychiatric, substance abuse, and co-occurring disorders. That has programs for children, teens, adults, and older adults. And that during the pandemic, telehealth services to thousands of adults and youths were provided. And the caring, compassionate service that Princeton House has provided consistently for a very long time to many people should be noted. And that as part of our proclamation that we actually passed on July 14th of 2021, marking the 150th anniversary of Penn Medicine Princeton House Behavioral Health. And the Mayor and Council of Princeton urged all our fellow citizens to join us in recognizing and commending the efforts of the board, staff, doctors, employees, and friends of Princeton House Behavioral Health as they celebrate 50 years of providing hope, innovating care, and changing lives. Congratulations and thank you to everyone.
Hi, my name is Calvin Chen. I'm Director of Counseling and Psychological Services at Princeton University, and I just want to congratulate Princeton House on their 50th anniversary. We are so appreciative of their partnership and support in caring for our students. Thank you for your excellent care, and we look forward to collaborating with you for another 50 years. Congratulations.
This day is a good day at Penn Medicine Princeton House Behavioral Health. A promising, positive day. It's a new day, dedicated to providing hope, innovating care, and changing lives. It all started in July 1971, when Princeton Hospital acquired Princeton House, an alcohol treatment facility, and transformed it into an inpatient hospital for those dealing with mental health and substance use issues. By 1980, Princeton House was already expanding, introducing a creative arts therapy program to enhance services in psychiatry and addiction recovery.
Well, it certainly makes me feel proud to see how they've grown and expanded, and they're doing things that we hadn't considered doing.
Further growth paves the way for the opening of SeniorLink, New Jersey's first private psychiatric partial hospital program in 1991. An inpatient eating disorders program follows in 1996.
There was a period of time where there wasn't specific and discrete eating disorder programming. People with eating disorders were treated either in a hospital or on a psychiatric unit, and that's just not a good model. That does not work for people with eating disorders. 25 years of treating eating disorders here in Princeton, and we're still going strong.
Throughout the years, Princeton House continues to expand its services for women, men, and young adults. Over the next several years, Princeton House advances its mental health offerings even further, opening a separate behavioral health-focused emergency department, starting a unique first responder treatment center, initiating a dialectical behavioral therapy outpatient program for adolescents, and merging with the extensive capabilities of Penn Medicine.
As we've run out of space, we've added space. As we've grown to a certain point, we've added physicians and therapists. And so the growth has been very, very steady.
It's just amazing how much we have been able to achieve while at the same time really focusing on our core mission and what really makes us special, which is our compassionate care and our focus on continued excellence.
We've organized a leadership team that is really dedicated, really dynamic, energetic, capable of imagining what we can be and then actually executing it.
The reputation has always been high, and that level of care has matured and far surpasses any other agency around.
I think we're seen as an honest program. We're seen as a program that really deals in the meat and potatoes of helping people. I think it's also respected in being a place that has expertise and cutting-edge care in terms of the treatment that's offered.
During the COVID-19 pandemic, Princeton House proves its ability to adapt, innovate, and thrive.
During the couple-of-week period between when we closed the offices and we started our virtual program, every patient was called every day by every therapist and every doctor. And 9 business days after we closed, we opened the virtual IOP program with the 140 therapists and the 30 providers providing care remotely to 600 patients.
For those needing inpatient care, new protocols for testing, social distancing, masking, and eventually making vaccines available to patients ensures Princeton House remains a safe place for treatment. Penn Medicine was among the first health systems in the nation to require vaccination for its employees as a means to keep patients and staff safe and healthy.
First of all, no place gets to a 50th anniversary unless you have the staff to carry it.
Every day is a challenge, but every day is also a gift. I actually love coming to work.
It's these little notes that they put on the young ladies' doors. So every morning, I'm Yvette, I'm the housekeeper. Your room was clean and sanitized. And I would leave little remarks every day, like stay in the moment, have a nice day, moving forward.
Care is embodied here. So care isn't a thing. Care is, it's palpable. Everybody really, in addition to providing great care, actually cares greatly.
Growing up, my father worked for Princeton House, and I always wanted to be a nurse and be in the healthcare field. Being second generational, I'm proud to do it.
When you believe in something that you do, and you believe in the hospital that you work for, and really believe that we are doing good things, it's hard to even think about working anywhere else.
I just want to say for the last 25 years that I've been here, it's been nothing but the best. And it's wonderful meeting the patients.
Our people are at the heart of what makes Penn Medicine Princeton House behavioral health what it is today. It's helped us to get where we are. It makes us who we are at this moment in time. And it will help lead us into the future.